Welcome back, my students. Dr. Ugwe here, and the chapter in front of you, cardiac action potential, is complete. We are left with a very small topic, that is the drugs affecting this cardiac action potentials. And with that, we wrap up this chapter 31 from Guide on Physiology. No need to write anything. My handwritten notes are in the description of the lecture. So, what are we studying today? We are studying the drugs which will affect the cardiac action potentials. For drugs, we have a separate book in MBBS course, that's pharmacology. But here we will study four drugs because they can be asked in your university examinations from physiology. So let's begin with the drug number first. Our first drug is sodium channel blockers. Sodium channel blockers. Now, what are these sodium channels? We know that in sinoatrial node, in SA node, there is presence of some channels. Clear? These are called sodium funny channels. Or these are called hyperpolarization cyclic nucleotide channels. Is that clear? What happens through these channels? Sodium comes inside of the acinodal fiber, and this entry of sodium is responsible for the generation of the heart rate in the acinode. Is that clear? These HCN channels or sodium funny channels are also found in the eye, and they are responsible for the vision. Now, this is about the sodium channels. Let us suppose we have a patient. Who has arrhythmia. What is arrhythmia? Arrhythmia is pathological increase in heart rate. We have a patient whose heart rate is very much. Now we are going to treat this patient. We give him sodium funny channel blocker. This is a drug. So when we give him this sodium funny channel blocker, that means we block these channels. Sodium will not come inside of the SA node. That means their heart rate will decrease, because entry of sodium increases heart rate. It is responsible for the generation of heart rate. So it will result in the decrease of heart rate. So we treated this patient. So we have an example of this drug, sodium funny channel blocker. Example is ivabradine. Is that clear? This is a drug. But this drug has a side effect. What is the side effect of this drug? We know that these channels are found in the eye, and they are responsible for the vision. So if we block these channels, that means this vision of the patient will decrease, because we have blocked these channels which are responsible for vision, which implies visual acuity will decrease. So there will be the decrease in the visual acuity. Vision of the person will decrease. Is that clear? This was the first type of drugs, that is sodium channel blockers, and we give an example of a drug, ivabradine. Now we move on to the drug number second. Those are called beta receptor blockers. In the previous video, we studied about sympathetic nervous system. When we stimulate sympathetic nervous system, it releases a hormone called norepinephrine. This norepinephrine acts on beta-1 adrenergic receptors. When this hormone acts on these receptors, it causes the entry of calcium and causes the entry of sodium in SA node and AV node. So there is more entry of calcium and more entry of sodium because this hormone acts on these receptors. Because of the entry of calcium and because of the entry of sodium, what happens is that heart rate increases in SA node. Because SA node is responsible for the generation of heart rate. So heart rate increases. And there is also one thing happening. There is decrease in conduction time. Now what is this conduction time? We know that SA node generates heart rate. Clear? It is present in atrium. Then the impulses go to AV node. Clear? Then the impulses go to AV bundle, and then the impulses go to ventricles. So SA node generates heart rate. Clear? It first contracts atrium, then the impulses go to AV node, then AV bundle, then ventricles. That time taken by the impulses generated by the SA node to go from atrium or the SA node to ventricles are called conduction time. So conduction time is the time taken by the impulse to go from SA node to ventricles or to go from AV node to ventricles. Is that clear? And when we stimulate sympathetic nervous system, it releases hormone or epinephrine through these receptors. It decreases conduction time. it decreases conduction time. That means less time is taken by the impulse to go from SA node to ventricles. Is that clear? Now if we give a drug that is beta receptor blocker, which blocks these receptors, if we block these receptors, calcium and sodium will not enter in SA node and AV node, which will result in the decrease of heart rate and increase of conduction time. Is that clear? Because we have blocked these receptors, so heart rate will decrease and conduction time will increase. Is that clear? Sympathetic nervous system increased heart rate and decreased conduction time through these receptors. We blocked these receptors, so heart rate will decrease and conduction time will increase. Is that clear? In the lecture 11th of the cardiovascular system, we talked about SC nodal action potential. SC nodal action potential. SC nodal action potential, same type of action potential is seen in AV nodal action potential. So SC node and AV node have same action potentials. It has a phase called pre-potential phase. It is from minus 60 millivolt to minus 40 millivolt, and this pre-potential phase looks like this. Clear? That means minus 60 becomes minus 40 because of the entry of sodium through funny channels and because of the entry of calcium. We talked about the sodium in sodium channel blockers. These are these sodium channels, and we talked about this calcium and sodium in SC node and AV node. These are these sodium and calcium channels. And if you want to know more about this SC nodal action potentials, watch my video 11th from cardiovascular system. So these were the two drugs. Number first was sodium channel blockers. Number second was beta receptor blockers. Now we will move on to the drug number third. Before moving, this right here is a ventricular action potential. Clear? It has phase 0. This is called depolarization phase. It goes from minus 80 millivolt to plus 20 millivolt. Is that clear? Then we have initial repolarization phase. Then we have plateau phase. Clear? Then we have late repolarization phase or phase 3. Then we have resting membrane potential maintenance or phase 4. Clear? And on x-axis we have time. That means from here action potential starts and it ends here. Clear? So this is ventricular action potential. If you want to know about this ventricular action potential, watch my video 12th of the cardiovascular system. This video is going to be about drugs. This is not about this action potential. Now look, this phase 3, this is called late repolarization phase. What happens in this phase? This plus 20, let's suppose at this time the potential is plus 10. Clear? What happens in this late repolarization phase? This plus 10 becomes minus 80 because of the exit of potassium. Clear? So positive charge is leaving the cell, so it takes the potential from plus to minus 80 value. Is that clear? Now if we give a drug, that is the third type of drug called potassium channel blockers. So what will happen? These potassium channel will get blocked. When these potassium channel will get blocked, this potassium will not leave the cell. Or it will leave the cell very slowly because most of the channels are blocked by potassium channel blockers. So this positive plus will become minus 80, but it will become slowly. It will not become abrupt because channels are blocked. So it will become slowly. Is that clear? And from here we will have resting membrane potential. Clear? So this is the phase 3, and then we have the phase 4. So now the action potential started here, but it ended here. Because of the potassium channel blockers, because now potassium is not leaving the cell, so this plus becomes minus 80 very slowly, like this. Is that clear? Now you see, this was the initial action potential duration from here to here. Now the action potential ends here. That means the duration of action potential increased by this. So we can say that if we block potassium channels, duration of action potential will increase. Is that clear? This was the third drug. So what is the effect of third drugs? Potassium channel blockers. They will increase the duration of action potentials. Initially action potential started here, it ended here. Now it ends here because potassium is blocked, it is not leaving the cell. Is that clear? Now we have the drug number 4th and the last drug that we will study. These drugs are calcium channel blockers. This right here is a ventricular action potential, and in this action potential there is a phase called phase 2, from here to here. It is because of the exit of potassium and an equal entry of calcium. What happens is that the amount of charge that is entering the cell is equal to the amount of charge that is leaving the cell. That's why this potential remains at a constant place. It's not either increasing not decreasing, because the amount of charge that is leaving the cell is equal to the amount of charge that is entering the cell. Is that clear? It is called a plateau phase. This stationary phase is called a plateau phase. But here happens an interesting thing. In this plateau phase, calcium is entering inside the cardiac muscle. Calcium is entering inside the cardiac muscle, and we know that for a cardiac muscle to contract, it needs calcium. And where is this calcium coming from? It is coming in this plateau phase. That means in plateau phase, calcium is entering the cell, and that calcium is responsible for the contraction of cardiac muscle. Now if we block these calcium channels, there will be no calcium coming in plateau phase. When no calcium is coming from plateau phase, because we have blocked these calcium channels, and calcium is responsible for the contractility, that means contraction. So what will happen? Strength of contraction will decrease. Strength of contraction will decrease because of these calcium channel blockers, because now calcium is not coming from the plateau phase. So these calcium channel blockers are called negatively, inotropic. Negatively inotropic. Why? We studied from the previous lectures, inotropy refers to the contractile strength. So positively inotropic factors are those factors which increase contractility, and negatively inotropic factors are those factors which decrease contractility. And we can see here, when we blocked these calcium channels, calcium doesn't come inside the cell, so the strength of contraction decreases. So we can say that calcium channel blockers are negatively inotropic. They decrease the contractility. Is that clear? And there will be one more thing. This plateau phase was because of the equal efflux of potassium and equal influx of calcium. Now the calcium channels are blocked. That means positive charge is not coming inside the cell, and positive charge is leaving the cell. So this plateau phase is like this. So it will not remain like this. It will go like this. Why? Because it was stationary. Because the amount of positive that was entering the cell, it was equal to the amount of positive that was leaving the cell. Clear? Now these positive channels are blocked, positive calcium. Now the positive is only leaving the cell, so it will take the potential from positive towards a negative value. That's like this. That means duration of this plateau phase will decrease. So what will be the another effect because of these calcium channel blockers? Duration of plateau phase will decrease. Is that clear? So these were the 4 drugs that we talked about. With that, we complete this chapter, cardiac action potentials. Now in the next video we are going to talk about the chapter 32 from Guyton physiology. Thanks very much. Your Dr. Ugi here. Keep revising and understand each concept, because that's your motive. You are here to understand how things work in human body. Class dismissed.